What's a care conference and why should you care anyway? We'll check into that in just a minute. My name is Evan from Forward from 50, and my passion is to help those of us over 50 to approach our senior years with confidence by being informed, by keeping our brains and our bodies healthy, and having some fun. Sounds good, right? If this type of information is helpful to you, please hit the subscribe button down below. If you're new here, welcome. If you're coming back, thank you. If someone that you care about is in rehab because they've had an accident or been ill, there will be a care conference. So in my story, super brief recap. About 5 weeks ago, my 93-year-old father, who lives alone, fell and fractured his pelvis. The second time in his life, we ended up with him in rehab. So I've learned a couple things and wanted to share them with you. My experience is after your loved one has been at the rehab facility for a couple of days, the staff has had a chance to get to know him a little bit. Each department has had a chance to visit with him. And so there's several parties that are involved with the care conference. Now there's usually 5 to 7 participants in the care conference. There's the nursing case manager, there's the physical therapist, the occupational therapist, the social worker case manager, the family advocate or the patient advocate, that's you or me, and the patient if that's possible. Now, you may wonder, where's the doctor? The doctor showed up every day at the hospital. Well, it's different in rehab. They come about once a week and they can issue orders as needed. And certainly the nursing staff can reach them anytime they need to by phone. But the nursing staff, they're the ones that know your patient and they are amazing trained professionals. So don't feel like you're being shorted by not having the doctor there every single day. It's really important as your loved one's advocate that you be there because you can be the voice for them that they may not be able to be. The nursing case manager, her job is to take care of everything health related with your loved one. They make sure that they get all their medications, that the nurses give the kind of care that are needed. All the things that go into maintaining your loved one within their room and in the facility. The occupational therapist is the one that will work with your loved one to make sure that they can do the day-to-day tasks. Dressing, bathing, cooking, brushing their teeth, that sort of thing. The physical therapist is the one that does the actual physical rehabilitation of the patient. They're the ones that make sure that the patient gets strong enough, steady enough, that type of thing, so that when they get home that they're ready for the challenges of regular life again. The social work case manager is the one that takes care of everything once the patient heads home. Make sure that there are wheelchairs and walkers if that's what they need. Make sure that there's going to be ongoing physical therapy, occupational therapy, schedule for bath aids, people to come that can help support your loved one once they get home. Another thing they do is they can provide the family members or loved ones with information on things like assisted living or long-term care facilities, things like that, that as lay people who've never gone through any of this, we just don't know. Also have information about Medicare, Medicaid, that kind of thing, so you can get a little more information on that as well. Each member of the healthcare team will give an assessment of where they see your loved one is right now, and then give you a timeline as to when they think that they'll be ready to be released. Now it's your turn as the patient advocate. You want to make sure that you bring up to the staff the things that you think will be important for them to know. Like in my dad's case, he had pneumonia previously. That was important to let them know. Also, I let them know that he can't always hear so well. And they may say things and he doesn't hear it, so he won't know that's what he's supposed to do. Some people have vision issues. That can be a problem, so it's really important that the staff knows that. And also, if there's dementia or forgetfulness of any kind, that's a regular thing, make sure the staff knows. Now, if you have any questions, this is the time to ask. And then lastly, it's the patient's turn. They can ask questions, express concerns, or just say, yep, I understand everything you guys are telling me. On a side note, with my dad, we ended up having 2 care conferences. The first one, after a couple of days, and they gave us a release date of roughly 30 days. Things kind of went sideways at first. He got the flu, and then he got pneumonia, and then dehydration. So the nurses saw this, they got a hold of the doctor, got him in the hospital very quickly. So he was back out within 3 days, back to rehab, and this time he was laser focused. He hadn't been able to give it his all before because he just wasn't feeling good. We had the second care conference when he went back in. They gave us a 7 to 10 day window didn't quite meet that. He needed a little more physical therapy and OT. There could be 2 or even 3 maybe. Either way, it's a great tool so everybody remains on the same page. So if you have any questions that maybe I didn't cover in this today, put them in the comments below. I read every comment and answer to each one. And if you've had an experience that's different from what I talked about today, please put it in the comments below. The more information, the better. So thanks for stopping by. Really appreciate it, and see you in the next video.